From the Toronto Star, I'm Saba Eitizaz, and this matters. Black Lives Matter. Last year, as we saw the reawakening of a movement due to brutal racism and injustice, we also had to face another reckoning. The coronavirus was stalking Black bodies too, killing disproportionately. Last year, data from the US and UK showed startling disparities. Here in Canada, initial claims of colorblind healthcare overshadowed the disturbing fact that Canada just wasn't collecting race-based data at all. We eventually did find out that Canada wasn't any different from the neighbors. COVID was hitting racialized communities harder. This data only came out after Black health leaders sounded the alarm and pushed for it. Dr. Upton was one of them. And these efforts led to important changes, like the launch of a pilot project, which he led to better understand why COVID was infecting Black Ontarians at a higher rate. He joins me today to talk about that project and its findings, and another important role he recently took on as the City of Toronto launched the Black Scientists Task Force to address vaccine hesitancy. Dr. Allen is the Division Head of Infectious Diseases at Sick Kids and one of the few Black people in his field in Canada. Hello, Dr. Allen. Thank you so much for joining me today.
My pleasure.
Dr. Allen, last year, as you saw the disturbing data come out of the US about how badly COVID-19 was impacting Black and Brown Americans, what went through your mind, especially in the context of Canada that normally doesn't collect that sort of data?
Well, when we saw data starting to emerge from the United States and the UK, we all felt that it was highly likely that similar data, if generated in Canada, would lead to reasonably similar conclusions. And that is indicating that individuals who are from Black communities, Black and racialized communities, would likely be disproportionately affected by COVID. We suspected that for a number of reasons, including the fact that in the 2009 H1N1 pandemic, there are data that showed that Black and racialized individuals were disproportionately affected.
And you were among some of the leading health experts pushing for this data now, right? Which led to a very important pilot project, which actually looked into why this was disproportionately affecting Black Ontarians. Tell me about that.
Let me back up and say that there are two aspects to the data generating process. Number one is getting race-based data that capture events that are associated with people having some sort of encounter with the healthcare system, for example, being admitted to hospitals. But another aspect is getting communities involved in research to generate data that apply to them. Both are very important. It's really important that we get disaggregated data that indicate who is affected by particular diseases, in this context, COVID. But also at the same time, it's important for us to identify where research is needed to generate additional data.
So can you tell me a little bit more about how you're doing that, who's a part of the project, and the method of research and community involvement as you're talking about?
So one of the first things that we needed to do, and anyone needs to do when you embark on research that involves communities, is to ensure that the communities are fully engaged. And so one of the things that we did was we established a community advisory group so that we were able to engage them and get advice from them before starting. Next, we wanted to get a better idea of the extent to which COVID has penetrated into the Black community. In other words, we wanted data that were more than just cases of COVID. In that regard, by doing antibody testing, we're able to identify individuals who got infected but were without symptoms, the so-called asymptomatic individuals. And that would give us a better idea of the extent to which the population has been infected with the virus that causes COVID. Second, we wanted to get a better idea of the various factors that are associated with getting COVID and having bad outcomes from COVID. And so this required meeting participants and getting a better idea of their socioeconomic, sociodemographic status, as well as getting information on their medical histories.
So the research involves a combination of antibody testing, the scientific aspect, and the socio-demographic data as well, which is quite unique. What do you aim to find out through this, and how will that fit into what we currently know about this pandemic?
Well, there's several ways that these type of data can help. Number one is that you get a better idea of the extent to which a particular community has been affected by COVID compared with the average Canadian population. And so, for one, you could then argue that when one thinks about resources to address COVID, perhaps there ought to be some discussion around proportionality of going to communities that are particularly affected, and by how much are they affected. Also, by getting a better idea of who's affected, one might be able to develop strategies to prevent those individuals from getting infected. And not only that, to provide support for those individuals. It also provides an opportunity to do additional things that not just benefit the communities, but also the individual. So, for example, in our research, we will be providing people with the opportunity to have their antibody testing repeated over time so that they can see the extent to which they remain protected, recognizing that there's still some discussion around the full extent of the protection, but at least for how long they continue to have antibodies and other markers of possible immune protection over an extended period of time.
And I know you're still researching all of this stuff, but as you wade through the data and see particularly how it plays out within populations of people of color, what's gone through your mind about what's happening and why this is happening from what you know so far?
So that's a really great question. We're still in the process of doing this study, but there's some things that we think are particularly relevant even without doing the study. And so the question is, what is it that the Canadian Black population has in common with folks in the UK and in the United States? And it's likely that what we're looking at are the social determinants of health. Beyond that, other issues as well. There have been issues that relate to unequal access to healthcare, equity considerations. There are issues around the types of jobs that people do that put them on the front line to be more exposed, their education, and therefore the types of jobs that they can get, their earning potential, and therefore perhaps not being able to work from home. Some people having to do multiple jobs to make ends meet. The types of homes that people live in terms of the number of people living in a home, a multi-generational home. So these are things that we suspect that the Canadian, UK, American groups of Black people have in common. Not everyone, but some people have in common. Our research, though, is still being done, and we'll be able to, I think, crystallize some of those factors even more as we move forward.
But some of these are natural sort of trajectories or parallels that could potentially be drawn with the previous studies, as you say.
Yeah, we think so. Not so much in terms of our previous studies, but also previous experiences that Black people have had with the healthcare system.
We'll be right back. We'll often hear that Black people, even before the pandemic, disproportionately suffer adverse outcomes in the healthcare system in Canada. And this applies to Indigenous folk in this country, to other marginalized communities. Do you agree with that? And what does that look like on ground?
So that's a great question. I think that on the ground, what is really important is the way that people access and utilize healthcare. And if there's a problem with accessing healthcare, then clearly one might have disproportionate outcomes for whatever disease one is looking at. Access itself involves several components. I'll just share with you a few examples. It might be that someone is not able to access the care that they need simply because that care is not readily available in their communities, or they might not be able to access it the way they should because they have a lack of trust in the system, which is a very important factor, and that people therefore might stay away from the system because they don't trust the system, and therefore their disease ends up being identified much later on rather than earlier on. So these are real important factors. And so I would say that while there's several factors, an important one relates to a trust of the system and how that influences access and utilization of the healthcare system.
Very interestingly, you brought up the aspect of trust, which is something I will come back to with you as well. So far, until this project and now the new research that's coming out, do you think that Black people have been largely absent from the way we talk about COVID? And how crucial is that representation in COVID-19 research?
I think it's important that Black people be at the table when issues relating to COVID are being addressed for a number of reasons. Number one is that all communities should be at the table when we're addressing COVID, all aspects of COVID, because we're all in this together. That COVID does not recognize racial or international boundaries. So it's a given that we should be at the table. Number two is that we are disproportionately affected. So it speaks to even more reason to be at the table. So I think that's really important that the Black community be represented. And there are other reasons for that. One is that it's important that communities see people representing them that might help to build trust, people with whom they can identify with, because we want to be able to ensure that all communities have a trusting relationship with the healthcare system.
And we're talking about trusting relationships, and you're also a part of another important team dealing with vaccines. Tell me about the Black Scientists Task Force and its work.
Well, the Black Scientists Task Force is a group of very well-accomplished and talented individuals who are involved with different aspects of COVID, but particularly focused on vaccines and vaccine education. And while there are different angles to its activities, one way to perhaps summarize the activities of the task force is to ensure that people get the right information that they need, so that if they make a decision to be vaccinated, it's based on correct information. If they make a decision not to be vaccinated, which is their right, it's based on the correct information. In other words, it would be really unfortunate if individuals choose to be not vaccinated based on incorrect information. So one of the goals of the task force is to educate and to ensure that the communities have the information that they need to make informed decisions.
And how are you doing that, providing that information and that outreach?
We have done this in a number of ways, connecting with communities. One is through connecting with the media, for example, through opportunities like this, or perhaps radio interviews that have been done, television, and most importantly, a series of town halls. There have been several of those during February and even last weekend that help to tackle different aspects of information related to COVID and COVID vaccines.
And when it comes to vaccines and vaccine hesitancy, we talked about trust earlier, but in this context, when many observers say racial bias in our medical system has been well documented, which doesn't just mean access to healthcare, but how people are treated once they're in the system. And that's been building up, and that could have led to a certain trust deficit between the racialized and the health system. And do you think that is something which could lead to vaccine hesitancy?
There's no question that if individuals do not trust a system, then when they're provided with information, they might have difficulty accepting that information. And then if they're fed misinformation or disinformation, then you can see how you end up with a very confused community who has wrong information and they don't trust people who are telling them that information is not correct. And so it becomes rather difficult. So trusting is really important. And the way to think about it is that the whole issue of vaccine hesitancy, I have broken down into three components. Number one is access, that there are some people who might be hesitant because of problems relating to access. I don't really have time to go get vaccinated because of my jobs, and I don't want to not get paid, Number two is that personal and religious beliefs that are really important. And number three is confidence, which has several parts to it. But one is the trust and the confidence that you have in the system and in the people delivering information to you, coupled with a time when you're accessing information through the internet and various places, and it's coming at all angles, and you're left with, well, who do I believe?
Have you come across some of these vaccine misconceptions? And is there anything that you'd like to say to address them?
Well, thank you very much. There are many misconceptions, and it will take us a long time to cover them. But one that is not too infrequent relates to the mRNA vaccines, the Pfizer and the Moderna vaccines, where people are asking whether or not the mRNA vaccines could change your DNA. That's been floating around in the internet, and the answer is no. And there's several reasons for that. Most important is that our bodies, the cells in our bodies, don't have the complex machinery required to even attempt to do that. So it just doesn't happen. There are others that I've heard, and by the way, these are not related to any particular racial group, but it certainly, is one that is present in the Black communities, but also other groups as well. And that is, would the vaccines provide an opportunity for people's activities to be tracked? And somebody said, oh, well, there's a tracking device in these, and again, that's, not the case. We've also heard that while these vaccines were developed by certain groups of individuals and they're targeted at other groups of individuals, and the people who developed the vaccines aren't necessarily members of the Black community. And that's not true. One of the individuals who is leading the development of the Moderna vaccine is a Black woman. Dr. Anthony Fauci said she developed the vaccine. So she's at least a co-developer, but she's clearly on the forefront. I have friends and colleagues who are Black who are very much involved in vaccine development relating to other vaccines as well, including the Pfizer vaccine. So Black scientists have been involved. The other point that I should mention is people often bring up concerns about how quickly these vaccines were developed. And the idea is that, well, we had COVID in 2019, 2020, and we decided that, the scientists around the world decided, well, we need a vaccine. Let's develop vaccines. And the work started there. And within 9 months, there was a vaccine. And that's not the case. And the reason for that is one of these bad situations that happened to mankind that turns out helping us. And that is SARS in 2003, 2004. SARS-1 in 2003, 2004, it was a cousin of the current virus that causes COVID. And shortly after that, research started on vaccines targeting SARS-1. And then also there was the Middle East respiratory syndrome coronavirus, the MERS-CoV. And there's also research being done on that as well. And then people are also looking at other coronaviruses, which are seasonal type coronaviruses. And so the research on coronavirus-related vaccines, that research has been going on for more than a decade. And so what it meant was that we were lucky that that research was being done so that by 2019, 2020, it was really pretty easy for scientists to pivot and focus on SARS-CoV-2. So it's a good news story that appears that vaccine development was rushed, but it actually has been going on for quite some time.
Dr. Allen, as a prominent Black infectious diseases expert, when you look back at this time, what does the work you did and what you're still doing, what does it mean to you? And what do you hope to achieve through it when it comes to Black and other racialized communities?
At the end of the day, what one wants to do is to improve health outcomes. It's really important that in the process of improving health outcomes, we work with the communities involved to let them be part of that process. I'm very pleased that we've been able to engage the communities in this regard. But we also recognize, Saba, that there are additional things that we have to do beyond COVID. We have to continue to address several other aspects of work that relate to the social determinants and addressing inequities. And so the opportunities that COVID provide could perhaps be divided into two. Number one is what we need to do to address COVID. That's of paramount importance. But also in the process of attacking COVID, what have we identified that needs to be addressed to take care of some of the factors that lead to health disparity or disparities, within communities beyond COVID. And so we need to look at those to prepare us so that if we have a COVID 2025,
I hope not.
We're better prepared. Hopefully that doesn't happen, but that we're better prepared.
Thank you so much, Dr. Upton Allen. It was so great to have you on the podcast.
My pleasure. Thank you.
I was talking to Dr. Upton Allen, Division Head of Infectious Diseases at Sick Kids, head of a pilot project researching COVID-19 disparities among Black Ontarians, and part of the Black Scientists Task Force. That's it for today. Thanks so much for listening. This Matters is hosted and produced by me, Saba Eitizaz, Adrian Chung, and Raju Mutter. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So-Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.